Have you ever noticed a breast lump, or you simply want to do a breast examination and you are wondering which one is actually better, a breast ultrasound or mammography? Class is in section. Come to the front seats. Hello, my name is Chinaza. I am a medical sonographer, and on this space it is everything ultrasound and women's health education. So between a breast ultrasound and a mammogram, which one is actually better? But before then, if you've been trying to conceive, if you're a TTC warrior, I call you warriors because I understand the struggle you go through. You are tired of searching on the internet endlessly. You are tired of confusion. You are tired of spending money unnecessarily on the wrong test. All you have to do is click on the link in my bio to join the community I have created for TTC mothers. I will be launching something very, very important and helpful very soon, and I want you to be a part of it. Now let's go back to the video. In today's video, we'll try to understand between a breast ultrasound and a mammogram, which one is actually better. So between a breast ultrasound and a mammogram, which one is actually better? The honest truth is, it is not a competition. Breast ultrasound and mammography are different tests with different strengths. One doesn't completely replace the other. Let us break both of them down. What is a mammogram? A mammogram is a specialized X-ray of the breast. It is the best screening for detecting early breast cancer in many women, especially before a lump can even be felt. One of the greatest strengths is detecting tiny calcium deposits called microcalcifications. This may be one of the earliest signs of breast cancer, and ultrasound often cannot see them. So what is a breast ultrasound? A breast ultrasound uses sound waves, not radiation. It is excellent for answering questions like, is this lump filled with fluid or is it a solid mass? It also helps evaluate breast pain, nipple changes, nipple discharge, infection, and lumps that are often felt during self-examination. Ultrasound is especially useful in women with dense breast tissue because dense breasts can make mammograms harder to interpret. What does it mean to have a dense breast? A dense breast does not mean your breast feels hard, firm, or have a lump. It simply describes what the breast tissue is made up of on the inside. The breast contains two main types of tissue, fatty tissue, then glandular tissue and fibrous tissue, which is called dense tissue. Younger women usually have more glandular tissue and less fats, so their breasts are naturally denser. As many women get older, especially after menopause, some of that glandular tissue is gradually replaced by fats. This is important because imagine hiding a white piece of chalk inside a bowl of flour. It will be difficult to spot because both of them are white. On a mammogram, dense breast tissue appears white, and many breast cancers also appear white. Because they look similar, small cancers can sometimes be harder to see. That is where breast ultrasound can help. Ultrasound uses sound waves instead of X-ray and gives a different view of the breast, helping doctors or sonographers look more closely at areas that may not be clearly seen on mammogram. So having a dense breast is normal, especially in younger women. It does not mean anything is wrong. It simply helps your doctor decide which imaging test or combination of tests will give you the clearest picture. So which should you choose? It depends on your age, your symptoms, and why you are being tested. Generally, women who are aged 40 and above are often advised to have regular mammogram screenings, depending on their individual risks. Younger women, on the other hand, especially those under 30 years with a new breast lump, are usually assessed with ultrasound first. Sometimes your doctor may also request for both tests because they provide different but complementary information. So does mammography expose you to radiation? The answer is yes, but the radiation dose is very low and considered safe for routine screening. For most women, the benefit of detecting breast cancer early is far greater than the small risks from the radiation. And then, can ultrasound expose you to radiation? The answer is no. Can it also detect breast cancer? Yes, it can. But ultrasound alone is not the best screening test for the general population because some early cancers, particularly those seen as microcalcification, may be missed. Also, ultrasound is also paired with biopsy in most cases for further evaluation. Now, please note, breast ultrasound is not better than a mammogram. A mammogram is not better than an ultrasound. They answer different questions in a complementary way. The right test depends on your age, your symptoms, your breast density, and your doctor's assessments. So instead of asking which one is better, ask which one is right for me. If you are younger, a breast ultrasound is better for you. And if you are older, above 40, a mammogram is the better option for you. And the answer to that question leads to the best care. Once again, instead of asking which one is better, ask which one is right for me. And that's the question that will lead to the best care for you. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more women's health education and ultrasound explanations that has been simplified for you. And I'll see you in my next video.